Today we're discussing non-alcoholic fatty liver disease, its etiology, diagnosis, and treatment. NAF is a rising public health epidemic. It's expected that it will surpass hepatitis C in the next decade as a leading cause of liver disease and transplantation. There is a correlation with obesity and the rise of type 2 diabetes in American culture. It's estimated that more than 6 million children in the U.S. have non-alcoholic fatty liver disease. The causes are obesity, metabolic syndrome, which includes hyperlipidemia or high cholesterol, type 2 diabetes, and insulin resistance. Contributing factors are also sedentary lifestyle, a diet high in carbohydrates, and high fructose corn syrup. Despite the Corn Refiners Association's many commercials, studies are showing that there is a correlation between high fructose corn syrup in the American diet and liver disease. Liver disease is diagnosed using liver function tests, which are blood tests, that show an increased AST and an increased ALT. Further diagnosis can be made on liver scans or through a liver biopsy. The treatment for non-alcoholic fatty liver disease is pretty much the same as what you would use to avoid it. Diet modification with reduced intake of carbohydrates and calories, weight loss, recommended 5 to 10% of body mass, and bariatric surgery in patients who were unresponsive to diet and exercise. Increased aerobic exercise has been shown to lower AST and ALT levels. Once fatty liver disease progresses to fibrosis and cirrhosis, the only cure is a liver transplant. Currently, there are more than 116,000 men, women, and children needing organ transplants in the U.S. More than 23,000 of those people live in Arizona. Every 11 minutes, another name is added to the national organ waiting list, and each day 18 people die from lack of available organs. More than 90% of Americans say that they support donation, but only about 30% know how to actually become a donor. For more information, visit arizonadonorregistry.org. In conclusion, non-alcoholic fatty liver disease occurs to a large extent due to the American lifestyle. Risk factors such as high calorie intake, obesity, and type 2 diabetes are epidemic. The treatment for non-alcoholic fatty liver disease corresponds to the best way to avoid the disease. Moderate calorie intake, lose excess weight, and begin a regimen of aerobic exercise. The only treatment for non-alcoholic fatty liver disease once it reaches end-stage liver disease is transplantation.